Well, Julie, would you like to go ahead and get us
I
started
would.
this morning?
It's my pleasure to welcome Dr. Bianca Murphy today in our really exciting and stimulating, at least for me, series of webinars. And this is such an important topic from any of you who are operating shelters or sanctuaries or rescues. You know that there's always going to be at least one, two, or if you're us, 30 birds that are going to be needing medications. So learning how we can work with our birds for them to accept oral medications is really a terrific and timely topic because even if you're not doing it now, you get to practice and find all the things that are going to be motivational for your bird and learn how to do it when the time is right, or even practice for the next 10 or 15 years until it becomes absolutely necessary. As we are in our 31st year, even though many of us are getting older, we don't think about our parents getting older. So we're not a senior citizens home yet. We're not a retirement community. We have lots of young birds that come to us as well. But we have a wonderful group of really, really amazing older birds who every day have something to teach us. Maybe they never fail to bring us tears, but they always bring us smiles. So we're so happy to have all the participation. And I'll just remind everyone that Kira has done an incredible job working with each of our presenters to make sure that we have the tools needed for these webinars. And we generally have them uploaded to our website or YouTube channel within 48 hours after the live presentation. I'm excited that our team is here today. We've got lots of wonderful stuff to proceed with. And instead of listening to me, I'm excited to switch this over to Kira and to Dr. Murphy. Thank you for being here.
Thank you for having me.
Right, I didn't have a whole lot else. If everyone can just make sure that if you have any questions popping up, put those in the Q&A. That's the easiest place for me to see them. And we'll try to answer all of those. If there are any outstanding questions, Julie and I will be sticking around to see if we can help answer. But if not, then we'll make sure that those questions get directed towards Dr. Murphy and we'll answer those and send out a big email to everybody. But I think that's all we have. Go ahead.
Awesome. Oh, so cool. Thank you guys so much. I have to say I'm like a little bit nervous because, well, yeah, I have like a profound amount of respect for everything that you do. So being even just like a tiny little part of it is a big deal. So I'm sorry if I stutter a little bit in the beginning, but I will catch my flow. No worries. So thank you guys so much for being here to learn more about, target training and specifically talking about target training to a syringe. As we go through this presentation, my hope is that I can provide y'all some tools, some foundational understanding, and some examples that we can think through that will allow you to go back to your flock at home or at the rescue work at or sanctuary or whatever it is, or to your patients, and to start to implement some of these things, right off the bat. So, essentially what we're going to cover is just review the problem. Why do we even care about this, right? How do we set the stage for success? What are the core 5 steps that you want to consider when you're building, when you're working towards getting your birds to accept medication and working through medication training? Honoring your birds, so trying to keep things as positive all the time, defining what is success, right? And then for as long as I can, answering questions, okay? So here's the problem, right? All of our birds are going to age at some point. And if we're lucky enough, we're going to be able to catch those aging changes and any diseases that come along with age before, like at a point where we can intervene, right? And many times intervention comes in the form of offering medications. Sometimes not the case, but many times that is. And so, for our little kid here, all of my pictures and things like that, they're either of my own bird doing example things or of patients that I've had in the hospital. And I love them all very dearly. So this little kid came in, wasn't able to stand up, wasn't walking, just kind of laying on their breast, not interested in eating. And as we all know, we could have suspicions about what's going on, but in the bird world, those are relatively non-specific presenting symptoms. And so, we were able to get x-rays, understand what could be going on here, and identify that our friend here had horrible, horrible arthritis, not only in the knees, but in the toes and in the hocks and in the vertebrae and everything. And so, this is what I like to call my crunchy old parrot. And they're so sweet and their mobility is limited and they're often in a lot of pain. And so we all know, I think, from our own experiences that arthritis is a chronic disease that we manage over time. And often there's a level of environmental changes, but also medications that we use to manage it. And, if you are just introducing medication administration to a bird who's well into their older ages, who's already in pain, it can be a struggle, right? And we don't want it to be a struggle. Everything we do is trying to improve their quality of life. So if we can get them to be a part of their medication event each day, then we've got a positive situation, right? The other thing is for these kids who are a little bit more on the painful side, we all know that pain medications aren't perfect either, right? So, you pick them up in a towel and they struggle a little bit, right? And you're kind of almost, are you going backwards as you're trying to go forwards by restraining them and having them move against you? These are all things that we need to think about, and we do try to think about, and where medication administration and how we do it can really make a difference in their overall quality of life. So, not only can medication time be stressful for our parents, but it also can be stressful for us, right? Like, we worry about, are we going to cause too much stress? Are they going to like us afterwards? I don't know about y'all, but anytime I feel like I'm causing stress to a patient, I get like heart palpitations. So it's one of those things where we have to recognize that there's both human impact and also parent impact. The other thing is, our whole relationship with our flock is built off of trust, right? So if we are creating these forced medication scenarios, we're chipping away a little bit at that trust each time. And eventually, we're going to have an empty bank account, right? So we want to be able to maintain and encourage that trust. Here's how things suffer. In the best of circumstances, we have great intentions, but if we're already medicating a bird and it's not very good, it's not a good experience, we're going to miss doses. We're going to skip doses because it's going to be like, I can't do that again, right? And ultimately, we may even delay going into the vet with our birds because we're afraid, oh, I don't want to have to give medications again. Maybe it'll just sort itself out, right? We don't want to have any of these things influence our patient care if we can avoid it. And so, again, working with these guys, target training, I think this is going to be a strong tool to help us avoid these types of outcomes. So, as we all know, poor acceptance is going to change your bird's medical care. And it doesn't have to be this way, right? So, this is Stanley. Just absolute love of my life. She was an older parrot that presented to us, presented to me, and she had a multitude of issues. Obesity was one of them, followed by pretty extraordinary osteoarthritis. And so we worked together for many years to kind of manage everything, and she's just wonderful. But the big thing is let's set the stage for success when we start this with our birds, right? Comfort is everything. we can, you can watch all sorts of videos online and you can see them on these in these formal training situations, but the reality is we're doing a lot of this stuff at home and we want them to be as comfortable as possible. So a lot of the things that we look at in books or, in videos, etc., they talk about a general population. And really what we have to do when we're thinking about behavior in birds is consider the individual in front of us. Take some of these foundational ideas and see, do they apply to this individual? How do they apply? Or how can I adjust them so that I can make sure that our interactions are as comfortable as possible, right? And we have to think about, well, what about the different species and some of their kind of ingrained different uh, uh, preferences, individual temperament that may be shaped by previous experiences, whether they're good or bad, right? What is their current emotional state? I don't know if y'all have experienced this, I'm sure you have, but there are some days when I go in to say hi to Ava in the morning, which is our morning routine, and she is like, I want nothing to do with you. Not today, lady. I want you to give me my foragers and I want you out. And I'm like, okay, I respect that. There are other times where she's like, hey, bestie, let's go. What are we doing today? And I think that recognizing that each individual bird is going to have different types of days, just like us humans. And I know we have to be careful about anthropomorphizing, but to understand these concepts, it's reasonable to a degree. So asking your bird, how are you doing? Watching what they respond with and shaping how you interact with them, especially when we're going into training scenarios, is going to really help your overall success and promote those positive experiences. I will tell you, there was a time where I would have some folks come and help me clean the house because I was just working so much and I couldn't balance it all. The days that they would come were not training days for us. So considering what's happening in the home, is that going to be a training day or not? All this should go through our minds as we're looking at our overall plan, how we set the stage for success, and what our routine's going to be. Biggest thing here is you want to meet the bird where they're at today, okay? And you're going to see in some examples coming up how I do that with Ava. Here's the big things that I stick by. Training sessions are short, 2 to 4 minutes. I don't care if Ava, which is my girl, my bird, I don't care if she wants to continue training past those 4 minutes. She's having the best day and she loves the target. Everything's fabulous. We keep it short because we can keep it positive. And if she wants to train later in the day, fine, we can do that. If we want to do it another day, then that's totally okay as well. So really promoting keeping things positive is going to help you move forward in achieving your goals. Okay, last kind of foundational thing, we're almost into some examples here. So the timeline is fully going to belong to the bird in front of you. We're talking about behavior being almost a study of the individual rather than a population, right? And you'll see that some birds you work with are going to progress very fast. Some will progress slow. And as long as we're keeping things positive, that progression, whatever timeline it's on, is going to be really cool. Because let's say, worst case scenario, you're working with a bird and they just refuse. You've hit the hard limit and they're not going to accept anything from that syringe, but they will let the syringe come to their beak, or they will choose to interact with the syringe with their beak. That's huge because now maybe you have them in a towel, but the introduction of the syringe is not a stressor. So even small steps throughout this process, achieving those can really make a difference for our friends. So big things to remember, forward progress is the goal, not the timeline. So as long as we're seeing slow and steady improvements over time, I don't care how long it takes, right? Sometimes, if you hit a wall and you have to step back a little bit, that's actually one of the most powerful pieces of information that you can get in training. And you're going to see, we're going to work through some things together with Ava as to like how we can work through some walls that she has put up. And then ultimately, not every bird is going to reach full acceptance, right? And that is okay because positive things are going to come from this regardless. So where do we want to start, right? You could start inside the cage, on the favorite perch, on a counter. Comfort is the primary focus. A familiar territory is going to speed learning. And you can see there's all these different examples. We have my buddy Nigel. He he was hospitalized for quite some time, and every single night we would dress up his entire cage. Well, it'd be twice a day with tons of foragers. And when he was feeling really good, he would have them all ripped down and shredded by the next morning, which is absolutely adorable. This is Jaspar. Jaspar loved being on his little perch and he would accept a grape. That was like his best, like that was his favorite thing to do. And then this little guy is enjoying just, eating and accepting fruit on the couch. Birds in this situation who like to be, on the counter, that may be a really cool place for you to start introducing some target training. So this is just an example. I'm using arthritic birds as a very common trend here because I feel like across the board between arthritis and atherosclerosis, those are the two primary medical issues that result in chronic, regular medication need in our older parents. And, when it comes to trying to navigate, do we put them on meds? Do we not? What are the pluses and minuses of putting them through this stressful scenario? I find that I'm having these conversations with owners and having these thoughts about my patients most of the time with arthritis and with atherosclerosis patients. So our friend here, you can see, we had him in what we used to call birdie boot camp. He was profoundly scared of toweling. We couldn't safely get him in a towel without him trying to injure himself. He was severely arthritic. And we said, all right, let's hang out with him. Let's have him here in the hospital over the next couple of weeks. And let's do boot camp with him. Let's start with simple foraging. Let's start introducing the syringe. Let's see if we can get him to be a part of his care and accept hands-off medication administration. He was not totally food motivated. And ultimately, it took him a couple of weeks, but he was able to start accepting medication from a syringe. And what you can see here is we introduce the syringe. He's leaning forward. He's interested in interacting with it. He's not scaring away from it. And he's not stoked on the sunflower seed. Maybe we needed to find a different type of treat for him, but he was also engaging. So these are really cool things. And everything we did for him was on a perch in his enclosure. We never took him out. We didn't ask any more of him. And it was a really big deal. He did really great. We used to do this with a ton of patients, and ultimately some of them would do fabulous. Some would not hit those marks, but the owners would help continue that training at home. And you do the best that you can. And I think that's the biggest take home, right? Is like if you go into it with the best of intentions and you try and keep it positive, ultimately, whatever the outcome is going to be your best work. So, all right, let's get into how this actually works. There's 5 rough steps that I tried to in a very fluid world of training, right? There are 5 rough steps that I tried to outline for us so that we can use them as a guide to bringing this into our homes with our birds. First, we want to identify what's called the reinforcer. I'm going to teach you guys what that is. And then we also want to identify the target. Okay. So it's very simple. And here I go. I'm trying to get ahead of myself because I'm getting excited. But once we identify these 2 items, then we want to make sure that the target is neither positive or negative, right? It's just nothing. It just exists. From there, we want to use the treat or the reinforcer to make the target something positive. Now that we have that association, we can slowly work towards the goal of using the target to get to the ultimate behavior. And then finally, you got to keep practicing, right? You can't just run a marathon and then expect to be able to run a marathon the next year without running every day, or at least a couple times a week. So, identifying the reinforcer is probably one of the most powerful things that we can do. The reinforcer is any type of vocal, touch, or treat type stimulus, essentially, that's going to result in excitement and reward. If we think about it in terms of like the human world, right? If somebody said, "Hey, if you go over there and you touch the syringe at the end of the block, there's going to be $100 that comes with it." I would go, I'll go over there for $100. I think a lot of us would. I would probably go over there for $5, but our parents, our parents, they want the $100 bill. Okay. So ultimately, that's the reinforcer. So for us, it's what we value highly. As I was going through when I first started my internship, I was working with my colleagues and my mentors, and they were teaching me about these principles. And they said, "Well, the first thing you gotta do is you gotta find a reinforcer." So I was going through different things with my own bird, and one day I left a jar of peanut butter uncapped on the counter in the kitchen. I turned my back for a minute. My bird flies off her perch that I have, kind of on the wall for her. She has like different places around the house. That's a whole nother topic. When she flew down, and I hear this like echoed sound. And I turn around and it's her vocalizing with her head in the peanut butter jar. And I go, "Oh my God, I just found her reinforcer." So, you know, when we think about what the reinforcer does, is it's that high value $100 bill, right? And it could come in the form of a variety of different things. We can talk about treats or fruits, safflower seeds, Madeline cookies, pieces of them. Small pieces are important, right? Pine nuts. Second to, what is it called? Second to peanut butter. Ava's second favorite reinforcer is the Harrison high potency, or not the high potency, the power treats. They kind of come in large blocks, so I have to crush them up. But it is like between that and peanut butter, oh my gosh, she'll do flips for me and I won't even have to train her. So, really finding that thing. None of these foods are healthy. None of them are good for them, okay? That's so it's important to understand that a reinforcer is not a component of the base diet. It often does not have much nutritional value. This is an emotional value food item, okay? Now, we talk about foods, but you can also use juices, right? Juices like cherry juice. I have a lot of African gray parrots who seem to really love cherry juice. I don't know why that is, but it seems to be a thing. Like, it'll be one of the first couple of things I try. Madeline cookies and cherry juice, pine nuts. Those are like the big things that I don't know, I seem like the grays like it. Um, and so, a little bit of mac and cheese sauce. I know this all sounds ridiculous. None of it's healthy. We want to have them on a good diet, but this is for training purposes. This is that $100 bill. Now, some birds, the $100 bill comes in the form of a head scratch or verbal praise. So, your cockatoos, the ones that like to cuddle up, that really get excited with that tactile reinforcement, a little head rub or a little armpit rub can go a long way, right? Verbal praise is something that I don't know if we give enough credit to. I definitely didn't when I started. And Ava taught me a lot about this. She loves to be told she's a good girl and I love you. Now, I don't know if she really understands what that means or if it's just the changing in pitch of my voice, but boy, does her eye pin, and she is like, it is her whole world is happy. So certain verbal phrases can really be a great reinforcer as well. You can pair these things together. All of this, I hope, is starting to go through your brain and say, "Oh, what could my bird's reinforcer be?" Now, one of the things that's really, really important, imagine Like, imagine if we were all trillionaires, right? Would we run to the end of the block for the $100 bill? I don't know. I'm not a trillionaire. I don't know how they think, right? But the theory is that you probably have $100 bills everywhere. So it's not as exciting. It doesn't influence you as much. So reinforcers need to be thought about as this very, very kind of like separate thing. You want to make sure that they are only offered during these training sessions. You want them to be a commonplace item, because if so, they're going to lose their value. So, if our birds are not transitioned to a formulated diet yet, and they're still eating seed mixes, etc., a safflower seed reinforcer may not go a long way, right? So these are things you want to think about. The other aspect is they should be able to be small enough bites and pieces so that they can eat it in just one quick chew. That way they can stay engaged in the training environment. And again, you're going to see some videos coming up, and we're going to work through them together. But these are really important concepts when you're thinking about how do you keep those reinforcers special and effective. So, okay, big take home. I know I said it 1,000 times just now, but the reinforcer is reserved exclusively for training, okay? We never want it, so that way it keeps its value. Okay, so this is my girl. Welcome. You'll see that this is very much like I have to replace these toys, I don't know, like once a week for her. I've become a carpenter myself. She chews through everything, which is fabulous, right? But for Ava, there's a couple of things I want you to see. Now, I've been working with her for years, but every single day I go into her cage, I go into her room, and I say, "Hey girl, how you doing?" And if we're going to train, I look at the situation and I say, "How are we going to make this comfortable for you today?" This morning I took these videos. Okay, so this is like real life what we did this morning together. And she did not want to come out of her cage yet. Totally fine. But she was excited, she was animated, she was talking to me. I would scratch her from the outside of the cage on her head. Life is good, right? So, in this circumstance, when we choose our target, we're choosing the syringe, but you could choose any inanimate object that you want. So, in these videos, I use a metal one of those reusable straws because sometimes she gets like she gets very excited. She'll break through the chopsticks. So the straws seem to be a little bit more durable for her. So you'll see that in the examples. But ultimately, if you're training for medications, you want to start by using a 1 cc syringe as your target. Why do we choose this? Because it is the most common method of administration of medications. And the reality is, I don't care how big your parrot is, your total medicine volume shouldn't be larger than 1 cc. If you're having a medication that's requiring you to give over a mil of fluid, I don't care how big the parrot is, what you want to do is work with your veterinarian to access a compounding pharmacy where we can reduce the volume by increasing the concentration. You can even get it nicely flavored, and that will really, really help the success of these types of medication administration events. But the big thing is we want to pick that 1 cc syringe and we want to start making it boring. So in this video, and I'm going to play it a couple of times, I'm working with Ava while she sits on her favorite perch in her cage. And you can see, kind of hidden in my hand, I've got the metal straw. And that's acting as her target. Oops, excuse me. Oh, I jumped way ahead there. Excuse me. Okay. So she's accepting the treat from my hand, even though that metal straw is present. She doesn't care about it. That straw is meaningless to her. The value of her little peanut butter cracker piece, which is what we were using today because I'm all out of Skippy, okay, um, is so high that she doesn't care about the metal straw at all. I also I started our training session essentially on her terms. We started simple. We didn't start advanced. Hey, are you interested in doing this? She said, yeah. So we made sure that the target was boring. Now, sometimes when you first start, all you're going to do is this: offer them a treat with a little bit of that syringe, maybe slightly visible in your hand, and just desensitize it. Make it kind of boring. So I kind of just went through this. This is for y'all's, I guess, review. But when we do desensitization, there are a couple of steps that we use. And every time you make a small step towards the desired behavior, it's called an approximation. You're getting approximately a little bit closer to your desired goal, okay? So once the syringe becomes totally boring and your bird is accepting the treat from your hand, even though they can kind of semi-see the syringe and it's getting a little bit closer to the face, that's when you start to say, okay, let's introduce this target a little bit closer. Let's introduce it a little bit more, and let's make sure it's a good thing. So when we're trying to determine, are our birds ready to move through these approximations or these small steps towards the desired behavior, we want to watch their body language. Are they looking at the target? Are they leaning towards it? Are they interested in touching it? And do they want to maybe interact with it even more? Do they want to hold it, right? These are all positive behavioral signs that we're going in a direction that they're willing to meet us at. If they were instead looking away, leaning away, we maybe offer we don't maybe see those behaviors, but we offer the target and they really lean away more. These are signs to say, oh, okay, they don't want to necessarily interact with this right now. Let's take a step back. But each of these things, these positive things that we see, we can reward. So let's pause. Whoops. We're going to pause these two videos and we're going to start with this first one. So we can see that the target is still kind of hidden in my hand. We're still meeting Ava in her cage, and she's accepting the treat from my hand. So now you can see that this metal straw has created a little bit more of a presence. Knowing that she has her favorite reinforcer, she does not care at all about it. She's also not interacting with it, but that's totally fine. So I said, okay, based on these two events, we can move to the next level. Now I have the straw right there next to where she would take the treat. Now, almost in a way, she has to interact with that straw a little bit more to get to her treat. But again, she's leaning forward, she's interested. Notice how much effort she's putting into it versus me. She's trying to come closer to me than I'm going to her. These are all very positive things. When Ava and I have this type of success in the beginning of our training sessions, then I know that I can reasonably ask more of her. If at any of these points she becomes standoffish, she doesn't want to repeat the behavior, her body language shows me that she's nervous, we hide the syringe or we hide the straw a little bit more, and we take a couple steps back. And I reward her for taking those steps back. Hey, look, we're comfortable again. I saw that you were uncomfortable. Let's take a step back. This is how you keep your training events very positive, right? Okay, so as we're going through each of these different approximations or small steps towards the desired behavior, we very quickly said, let's touch the syringe. Let's let the beak kind of engage with it. Maybe the tongue wants to explore it a little bit. After you have really good acceptance of that syringe, the next steps are going to be adding some flavored liquid to it. Maybe having them, it's not a perfect process, when you put the liquid in the syringe for the first time, sometimes you want to smear whatever the reinforcer is around the end of the syringe, right? Sometimes you want to just let it let some of the juice, if it's cherry juice, for instance, on the outside of the syringe, because they're going to touch it and they go, "Ooh, that's good." And then you can deliver a little bit of that liquid and they go, "Oh my gosh, there's more." That's like $200 at the end of the block, right? And slowly but surely, you can use small steps like that to get them to accept the full medication dose. Now, here's what, you know, we talked about using the target and slowly bringing it into frame, making sure that the birds are interacting with it in a positive way. And here, Ava still didn't want to come out of her cage, totally fine, but she is 100% down. She wants to know where that target is next and when her next reinforcer is coming. So she's engaged in this training scenario. Oh, one more thing. You'll hear, I'm so sorry. You're going to hear me not only, you're going to see me reinforce her with her peanut butter cracker, but you're also going to hear the positive reinforcement that I give her like vocally, and you'll watch when her eyes pin. So I'll play this for you now. Yeah, there's her eyes pinning. Oh, so I'm so sorry. I think we all talk to our birds like, we're alone and we'll be alone forever. No one else going to see us. But the point is that, well, there's 2 points. First is I need to go spin her toy clip there closed. I'm like looking at that, I'm sweating already. I got to go do that. But but second is we introduced the syringe. We didn't put it, or excuse me, we introduced the straw. We didn't put it in her space. She came to the straw, chose to interact with it, got excited with her reinforcer, even more excitement with the vocal stimulation. Ultimately, you can see how these different type of reinforcement environments are very positive and how she is continuing to engage in each in scenario I present to her. I bring the straw up, she comes to it. I'm never forcing it into her space. And so I go, okay, this is really good. Ava, you're doing fabulous. You can see now that instead of the syringe or the straw in her case being just near the treat, she's actually touching it. That's the next approximation, right? So we talked about how food vehicles help and how you can add all sorts of different juices to the syringe as you're getting ready to move to the next step and deliver the oral medication, right? And people use all sorts of stuff. You can use, and you know what's really interesting? If your birds were hand fed, and I know that some of us didn't have control over if they were hand fed or not before we got them, but they still like their hand feeding formula. You can do a dilute hand feeding formula, dilute mash, applesauce, baby food, anything that's delicious, that's not toxic, okay? And put it in that syringe. Essentially, the liquid, it becomes the reinforcer. Okay, so when we're talking about maintaining things, right? I really wanted Ava to come out of her cage today because I had to do it was replace the toys, a big clean day. I know we all have those. And I didn't want to force her in any way. And we were having a really good training section. So I said, okay, let's see if I can bring this one step further. I put her favorite power treat. This is like someone saying there's $500 at the end of the block. Okay. And so I put her favorite power treat up there on the top of her cage, but then I also have the straw ready for her to touch because she knows when she touches it, she gets good things, right? So I asked her to see if she wanted to come out of her cage, and here she comes. She wants her treat. And here's one of the things that's really interesting. That is a full nugget, right, of power treat. Notice how it took her quite some time to eat that whole food item. That item as a reinforcer is too big because instead of it just being a quick little nibble and then she's ready to go again, she sat, she changed her focus from the training event to this treat, and you kind of lose focus there with some birds. So, in a perfect world, if I was using those power treats as reinforcers for an active training session, I would break them up. I'd, put them in like a little what do you call it? Like a plastic bag and hit them with a hammer, and break them up into tiny pieces. So, I'm going to continue to play this. Notice she's engaged with me still. We've just changed our training environment, okay? But she's still down for it. So we can see like she's like trying to get to the target. She sees it in my hand. I haven't presented to her yet, but she's like so ready to go, leaning forward. All this behavior is great. Now, we're getting close to our 4 minutes. And if we think about all of the different steps I took her through to get her to this point, each step of the way, we've made sure that it's positive and she is showing that she wants that interaction, right? Oh, let's go here. Here we go. Okay, so again, you can see I gave her too big a piece that was too big of a cracker. Oh, that was a good moment. So I offered the syringe, excuse me, I offered the straw. She was still chewing on her treat because it was too big. And ultimately, she was like, I don't really want that right now. So what did I do? I immediately took it away. We're going to have a reset moment. And I'm asking myself, are we done training right now? Or was it just that I gave you a treat and you lost focus? So now we have to just give ourselves a moment. There she goes. Very excited. She still wants to train. All of these things are really good, right? So we continued like that for maybe about 30 more seconds. And she, like, clearly, it is her day. She was totally down for training. She was all about this. And the reality is that, how do you know when you're done? That would have been a very reasonable place to stop for her. But I was making these videos for you guys today, and I wanted to show you and actually get some feedback from y'all about this next video I'm going to show you. So, as we know, we saw some forward movement, but depending on the bird's choices, what they want to do, how they want to interact that day, you move forward and backward through these steps, always keeping it positive. If you're not making that positive, if you're not making that forward motion towards your goals on a day, think about it this way. Even though we didn't make progress today, you put more deposits in that bank of trust. And the next day, that trust is going to be there and it's going to be stronger. And I bet you're going to be able to make that move forward with your training. So every little moment, even if it's a backwards moment, is positive. So as you're going through this, right? Let's say you get your bird totally desensitized to the target. The target you chose is the syringe. You have strong reinforcers. Life is really good. How do we advance this, right? How do we go from them just accepting it to really making it that much more powerful and maintaining the power of it? You want to make sure that before they're sick, if we can, we don't always have this opportunity, right? But start young. Start when they're healthy. Make this a fun time for you and your bird where you have those positive interactions before they're sick. And do it a couple times a week, right? I like to do it with Ava when we do like cage cleaning time. That works out really nice for us in our schedule because I always have time for that each day. But everybody makes their own schedule. Sometimes you can use water in your syringe. They don't have to be, when they're getting advanced, they don't have to be treated every single time. That's okay. It's good to generalize the skill. So rotate the time of day that you do it. And even if there's multiple people in your flock or your household, have them work with your bird on it. Now, the important thing is that sometimes when you add these new variables, you're going to see some regression in their skill set. That's okay. That's where you go, whoa, that regression is really informative. Let's work through it together. And I think you guys are probably sick of me hearing this, but always end on a win. Win. So always keep it as positive as possible. Okay. So we talked about different signs that we can see in our birds to know when we can move from the step that we're at to the next step. So after Ava came out of her cage, I said, all right, let's try something new. Let's see if she'll come to me, come to the syringe, or come to the straw in this case. And I have to ask her to move quite a distance to get there. Yeah. And there she goes, I'm so sorry you guys have to hear me, but it's so important because these types of things, that vocal reinforcement is so positive for so many birds that if your bird really likes that, it really adds an extra win for them. And she, on her own fruit, like on her own volition, chose to interact with me, chose to come to that syringe. I didn't put anything in her space. I didn't force her. Not only did we earn trust together, we also made this very, very positive. So there's situations where your bird can be on the counter in the kitchen. Let's say you guys are hanging out, you're getting meds ready, and they walk right over and they grab the meds from you. That would be amazing, right? And that's totally within the realm of reality. Now, we talked about when to step back. Tense posture, leaning or moving away from the target, refusing the treat or the reinforcer. Sometimes you just have a bad day. If it's a bad day, give them a little bit of their reinforcer, give them some love, and don't train that day. And that's okay. And then we want to just make sure that if something happened with the last session that ended badly, that we just want to reframe it. So, hey, if it was a tough go, we look at this and we say, okay, how can we introduce things differently next time so that it's positive? No one's going to be perfect, okay? Don't stress. I'm not perfect. No one expects you guys to be perfect. We're just trying to do a good job here. So again, stepping back is not failure. This is really, really good training because you're recognizing where your bird is at in that moment. Okay, so I thought Ava was all into it. I was like, girl, let's see if you will fly to me, if you will fly to the syringe. Let's amp this up. Now, this specific skill for her is not very good. Complete transparency, I probably should work towards this skill a little bit more, but I went for it. And this is what happened. Okay, so my question to you guys is, you see this, right? And you saw how well she was doing. This is the end of her training session. What do you guys think about the choice I made to go from where I started to this? Do you think that that was too large of a gap between skills that I was asking her to complete? And if you just want to put that in the chat, I'd love to know what your thoughts are, if you're comfortable with it. If not, you don't have to answer. And if you do think that it was too big of a gap, what do you think could have been done? Like, how would you change your approximation in this case? What would you do? Yeah. Yeah. Oh, you guys are doing, oh, I'm obsessed. I'm obsessed with these answers. This is amazing. Yeah. Yes, 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 yes. Okay. Y'all are thinking right along the same, the right path. And here's the thing. I'm over here giving this lecture, right? And I'm doing this at home. Nobody's perfect. You get excited because your bird is doing well and you go, oh, let's go advance today. And you make too big of a call. And everybody who's saying it's too big of a step, absolutely. The fact that you were able to take this time with me, just this short period of time, and then look at this video and make that call means you are totally ready to work with your bird and to evaluate what approximations could be reasonable. And then when they're not successful, reevaluate and change your plan. So this is like amazing. And for everybody who's saying maybe get a little bit closer, absolutely. Like I'm obsessed with you all. It's perfect. So what did I do after this? I said, all right, that's too much, no problem. We took some steps back. She's on her cage door. We did some basic targeting there. I treated her, and then I put her foragers in her cage, and she had her good morning. So really, really fabulous as far as, looking at this video, making those interpretations. And you can see that I was able to go, oh, I went too far. Let's take a step back. Let's keep it positive, and then let's be done. So we've reviewed all of these things, really looking at your individual bird each day is so important to keep things positive. And the reality is, as you just saw with Ava, sometimes it'll work and sometimes it won't. I think we can all see that trust was built in that experience, even though she didn't want to fly to the perch like I wish she would have, right? The same thing goes. Trust is going to be built, even if that day when you're training, they're not taking the meds from the syringe yet. And that is huge. So, our big takeaways here are you want your training situations, your training scenarios to be short, positive, and you want to stay as patient as possible, even if you get excited, right? Like I get excited easily. Reserve that reinforcer for training only. Start in a situation where your bird is most comfortable, and then you can expand on that, right? Move fluidly forward and backward within your approximations based on how your bird is doing. If you can, practice before illness, right? Let's try and get these things as a part of just their daily routine, right? And ultimately, if you're not totally successful, that's okay because positive things are still happening in this event. So I know I've said this a couple times, but my mentors just absolutely drilled this into me. And it has been probably one of the most powerful things that I think about when I interact with birds is that every minute you spend training with your parrot, whether it's to accept oral medications or just target training or whatever it may be, you're putting those deposits in the bank of trust. And there's going to be a time where you're going to need to withdraw from that bank, regardless of how much training that you do. And you want the balance to be really big. So if you can, start today, start small and stay patient, and you're going to be successful. Now, I have to call out my mentors. So I trained at Medical Center for Birds with Brian Spear, Brenna Fitzgerald, Jeff Olson. Those were my veterinary mentors. And then I had just the most incredible nurses that also supported me through all sorts of situations. And Melody is one of the people. She owns Busy Beaks Academy. I'm sure you guys know her. She is just a dream. And she's the one who trained me on a lot of these different things. Melody has an incredible amount of media on YouTube. She does different types of appointments virtually. She's incredible. She does things that I can't, and that's why working with her and everybody on the team is really, really special. So if you're looking for other types of media, different examples. If you need a bounce, if you need someone to talk to about where you're at, I think that Busy Beaks has those different resources for you, whether it's Melody herself or just the resources she puts out on the internet. And yeah, I literally couldn't have done anything without them. I have like one small story um, that I want to share with you guys about Melody and then one of the other nurses, Brandy. So I was an extern. I was still in veterinary school. I was at Brian's practice, and he was teaching me how to work with birds, handle birds, their behavior, etc. And he put me in the small exam room 3 with a semi-ornery African gray. It was a Congo. And he goes, I want you to handle this bird, and it can't make a peep. And Mel and Brandy were in there with me. And this bird absolutely beat me up emotionally. It was the funniest thing. I came out laughing and crying, but they talked me through it. And I just really, I think that, I have to just pay massive amounts of respect to all the people who helped me get to the point where I can sit here and teach you guys how to do this. Um, so thank you all so much for your attendance. Thank you for your interactions. This is Ava. She got a ton of peanut butter this day. We couldn't train for like 2 weeks after this.
Aw.
But ultimately, I'm here for any questions that you have. And I hope that this was informative and gave you some good foundation to how you can bring this into your home and to your bird. So thank you guys so much.
Yay. Thank you, Dr. Murphy. That
Yeah.
was such an incredible presentation.
Oh, thank you.
And
I'm still nervous.
no, I think that's wonderful. I was taking notes. I have some really good takeaways, and we're people that
Cool.
administer, again, like 60 medications a day. And so
Yeah.
this is just, it's such good review, and it's very accessible for people that are in shelters or at clinics or
Mhm.
owners. And so we do
Oh, great.
have a lot of questions. So I'm
Okay.
going to pick and choose some of the ones here. And again, if we don't
Hmm.
get to your question, I will make sure to send these to Bianca and we'll answer afterwards. Um,
100%.
okay, perfect. So let's see. One of the questions that we have here is, could you explain a little bit more about how to get from the stage of their birds are touching the syringe and then
Hmm.
to maybe accept some of those liquids, so the water or the cherry juice. This
Yeah.
person said once they tried and got juice all over their bird, and they have a little bird. So, do you have any tips for kind of that transitional period and making that a little bit easier?
That's a really good question. It's the hardest. That's the hardest part about all of this. I'm going to, let's see. First of all, I'm going to pull this up. This is a video that Melody has um, on YouTube, so you guys can access this. Sorry, my video may get a little bit funky, so let me just turn that off for a second. Um, so first of all, it's a messy process. It's imperfect, so don't feel nervous about that. It doesn't have to look super clean. And here you can see that there's a little liquid in the syringe. Maybe there's a little drop at the top. And you see that little bleb. That's all we're trying to get them. And they go, ooh, that's exciting. So now we've got juice. I'm almost positive that's cherry juice. Let's see. And you ultimately just slowly add more liquid each time you offer it. Let's see. Cool. So hopefully, I'm going to just turn my video back on. Hopefully you can use this as a way to slowly get your bird. So it's a little drop at the tip, a bigger drop, maybe they go, "Ooh, that's delicious," and they hold on to the end of the syringe, and you could offer more at that point. You just have to see what behavior your bird is presenting to the syringe and then kind of go from there. Um, I Yeah, like getting it, getting the juice everywhere is like Ava would get peanut butter everywhere. I would put peanut butter on the tip of the syringe because it was a little sticky. And then I would have juice on the inside, which she also liked. And she would want to touch the end of the syringe, lick the peanut butter off. That would help her kind of stay at the end of the syringe a little bit longer. And then I could slowly deliver small amounts of the juice, which she also loved. And it was just like, that was like $500 to $1,000 for her in that moment. Eventually, you're able to take the peanut butter off the outside because she sees and knows that the juice on the inside is high value. I hope that that helps. Again, everything is going to be like like it's going to be tailored to your situation. You just have to see what works. Does that help at all?
Well, I like seeing in this video how she's
Mhm.
holding the syringe vertically.
Mhm.
And so then the bird can take the little droplet off the top. And then you see, even as they go, that they hold on to the end of the syringe a little bit longer. And so I think that's then when you could maybe try to administer just a little bit more in the mouth while they're holding on to it.
Mhm.
Those again are all those just like little small approximations of like little drop, slightly bigger drop, hold on to it a little longer, add a little bit more. Um, I
Exactly.
think, yeah, the video
Exactly.
demonstrates that really, really well. Let's
Yeah.
see. Okay, one question that we have, um, how would you go about training with multiple small birds? This person has three budgies, and they
Mhm.
live together and they're comfortable, all kind of being together in their little play gym that's on top of their cage.
Oh, that's so cute. Okay, that's a really good question working with multiple birds. I think that when you're in the early stages of training, getting them in situations where you're working just one on one with the individual bird is important. You can build some of those foundational behaviors essentially. But then from there, once they've got those foundations, well, they may all just run for the syringe to you for you, you know. So in that case, you know, again, you may want to try and just keep it one on one if you can. Um, but Gosh, it all just depends. I know that's a horrible answer, but it's the one I would always get about everything. And I think that the reality is you just have to see, okay, can I separate them successfully? Can we do, can there be positive interactions in a training situation with them separate? Now that I have achieved that with each of them, putting them back together, can we continue to have those positive interactions where we move forward through the different steps? I think if you have all the foundational behaviors and you have multiple birds and you're just trying to like do your daily practice, that's probably a lot easier than trying to start from ground zero training. So it's a little bit of both depending on where you're at in your training kind of spectrum. Does that make sense?
Yeah, yeah, I like that.
Okay.
It can be hard with those little guys that always kind of like to be together, but also I think one of the benefits is like if you have one bird that is maybe has a little bit more training momentum, then they can also encourage the other guys that might be a little more timid to participate and
Hmm.
make some of that behavior. So yeah, I think it'll,
Absolutely.
but it can be hard with those really littles.
Yeah, it can.
See. I have two questions that are not the same, but could kind of go together, I think.
Hmm.
We had one person ask, how do you work with medications that are bitter or don't taste good? And then we had another person, their bird is on isoxaprine and enalapril, and what they've
Hmm.
been doing is mixing those in with baby food and then offering it on a spoon.
Hmm.
And then they asked about your thoughts about mixing it with the baby food. And they asked also, does it lose effectiveness with long-term use?
Hmm. Really great questions. So, to address the bitterness component of it, That's where I would work with a compounding pharmacy really closely to try and see what type of flavoring options can mask that bitter taste. Sometimes there's different ways that they can formulate the liquid so that it doesn't have those components, or they can mask those components. So that would be something that you would bring up to your veterinarian, whoever you're working with, and then you guys can all collaborate. Usually what happens is the veterinarian calls the compounding pharmacy, then the compounding kind of gives them the lowdown of what we're trying to achieve. Then the compounding pharmacy calls the bird owner and says, hey, here are our options. What do you think is going to work best for your bird? And then you guys kind of work together from there. So if you haven't done that already, absolutely worth your time and effort to try that as an option. Now, when it comes to delivering medications not through a syringe, let's say, for instance, using a spoon or something similar, I love this too. So let's say, for instance, you have a bird who has a previous significant negative experience that they've associated with the syringe. Maybe they've never seen a spoon before in a negative situation. Offering some juice or that reinforcer on the spoon, using the spoon almost like the target, right? It'd be essentially considered a different form of a target, is super effective. And when you're going to choose between your targets, maybe a spoon's going to be the right option. That's where your different juices or baby foods or whatnot are going to help. And you know, the reality is when we put medications in the food or in a liquid, right, and we mix them like that, there's no studies that show us that things are going to stay 100% effective. But what we do have is years and years and years of doing this with our patients and seeing that their medical management for whatever disease process they're dealing with it remains solid. So imagine, we're talking about isoxaprine and enalapril. These are medications that are used to help manage atherosclerotic disease and symptoms secondary to that. Those clinical signs are often, you can tell when they're not feeling good, and you can tell when they start their meds and they feel better, right? If those meds weren't working in the method that we were delivering them, we would know. So even though there's no peer-reviewed studies that support that these medications are totally stable and fine and work perfect, our birds are telling us that it's okay. And to be honest, that's enough for me in that setting, because the last thing I want to do is try and, you know, say that science, like I have to force this medication in this bird because science hasn't proven to me yet in a peer-reviewed journal that this works. Meanwhile, it's been working, and we're okay. So we're just going to have to accept that there's a little bit of a gray area. And I love that the spoon works for your guys, for your kid. I think that that's fabulous. Keep doing it. And if the syringe doesn't work for everyone's here, if the syringe doesn't work, a spoon is also a really great option.
Awesome. All right. Do you think we'd have time for one more question?
Absolutely. Yeah.
Yeah. Okay, perfect. So we have someone that is currently having to give their birds medication.
Mhm.
Do you have any recommendations for starting this training while they're already having to administer the medication?
Yeah. I think that can be a little bit challenging, um, because, we have this like internal need to make them be successful in those situations. It's like, oh, I need you to get this right away so that we can stop having to towel you, etc. But if we recognize that that emotion is probably present, right? At least it would be for me in a setting like that. And we look at the basics of, how do we build the foundation for this individual? How can we separate, you know, the medication event that we have to perform from training? A lot of times you can be successful. Like, for instance, I presented that one case where we had him in birdie boot camp, and that little guy he did great. So start from square one, build a strong foundation as we discussed, make sure that your bird is in a comfortable setting, Start slow, be patient, separate your training events from your medication events. Make sure that your reinforcer is novel, right? And powerful, and see how far you get. Now, I think that for many birds, you can be quite successful for this. Some you won't. But like I said throughout the lecture, you're going to have positive experiences. You're going to build in that bank of trust. And overall, you're going to strengthen the bond with your birds. So if that's all we get from it, then that's okay too, you know? um, but I hope that that helps. I'm sorry. I wish I had perfect answers for these questions. They're great, but these are my thoughts. So it's what I can share with you.
Yeah. I really like separating the two things of like your training is its own separate event apart from the medication administration. And so you can build
Mhm.
that positive association in a different setting and hopefully it starts to transfer over to your medication administration. But it can be hard when you feel like you might be depleting that trust bank by having to administer medication, especially if it's every day, sometimes multiple times a day. Um,
Exactly.
yeah.
Yeah.
We just had a few questions that were
Mhm.
concerns about aspiration, and I think that
Mhm.
people want to talk about that real quick. So,
Totally fine. Yeah.
are there any things that you advise people be careful of in terms of their actual administration angles or anything like that, so that
Mhm.
they can avoid any concerns of aspiration?
That's an excellent question. Definitely a concern when we're using large volumes. So I think that there are two variables that we have to consider. First is should be slow and steady. It shouldn't be like squirt it in and pray, right? Because that's going to be more likely to cause aspiration. However, the other aspect to it is the volume of medication that you're delivering. And like I mentioned briefly early on in the talk, we really don't want our medication volume to be greater than a mil for these guys, right? Even a mil is like a lot. So if you find that the volume of medication is increasing your concern for aspiration, work with a compounding pharmacy to try and get that concentration up, which will bring the volume down, and it's going to create a safer situation. If we go slow and steady and you have a reasonable volume that you're administering, aspiration is going to be a very, very minimal concern. But the right thing to think about. I like it.
Yeah, awesome. All right. Well, I think I'm gonna cut it off there so
Sounds good.
we can get scooting. But thank you
Yeah.
again so much, Dr. Murphy.
Oh, thank you guys.
A joy to review your presentation. I think it's so great for all of us that are even in the field and do these things on a daily basis. Some of those really good reminders. But yeah, Julie, do you have
Wonderful.
anything to finish us out here?
Well, I'd like to just support what Dr. Murphy has said. We have one Moluccan cockatoo who had been being cared for by Dr. Laura Wade in New York, and he's a very experienced medication escaper. And he came to us with instructions that it was okay for him to have his medication in whipped cream because
Yeah.
we love whipped
Yeah.
cream. We have another bird, and one of our staff, Melissa, has this, her bird needs medication daily and nothing worked, but for some reason she likes sour cream. So again, everything in moderation. They love holding the spoon. We have many people that we recommend yogurt. If you can do a plant-based yogurt, that's great. And remember, it's not always just the food, it's the amount. So I think it's really important for everyone to heed what we've talked about and what you've so accurately brought up in terms of amounts and how to medicate. It's a wonderful thing, and I think that our anxiety about doing this when we don't know and it seems so new is like, oh my gosh, are we going to do that? But just be patient, give time. You relax, the bird's going to relax. And I think your information today was wonderful. You did it all with a
Thank
smile,
you.
great pictures. It's wonderful to see Melody's work, your work, all the all the skill set and knowledge that everyone has brought to the table that makes us do better. So we
Mm,
can't thank you enough for everything. Really
yes.
Oh,
appreciate it.
So,
And
thank
to
you
our
for the
audience
opportunity.
as well.
course. Alrighty. Well, and thank you everyone for joining us today. We wouldn't be here if we didn't have our community of people that wanted to learn how to better care for their birds, and we're interested in these things. So, big round of applause for everyone for wanting to improve their birds' care, and we hope that this can really be beneficial for everybody going forward. Yay, lots of surprises. All
Thanks,
right, everyone,
everyone.
say thank you. Thank you for joining
Thank
us
you.
today. I will have this
Bye.
thing up tomorrow, so we'll see you all then on YouTube. All right, bye.
Bye, y'all.
Bye.
Have
I'll
a good
take
one.
care.
See
Bye.
you.